Hey everyone, you know how we always say the best solutions are often the simplest?
Right.
Well, get ready for a deep dive into the world of burn care
Okay.
because it turns out some ancient wisdom is making a serious comeback.
It's pretty remarkable how much we're rediscovering about effective burn treatment from centuries ago. Like we're going all the way back to the ancient Greeks with this.
Seriously, you sent over this fascinating article, Current Opinion in Critical Care by Dr. Tina Palmieri,
Yeah.
and my mind was blown. So we're diving deep into the latest advancements in acute burn care. You'll want to know this stuff.
Absolutely. These breakthroughs can truly make a difference, not just in clinical settings, but also in those critical moments right after a burn happens.
Okay, so let's start with first aid. This one blew my mind. Dr. Palmieri talks about this incredibly simple yet effective technique. 20 minutes of cool running water applied to a burn within 3 hours of the injury.
Wow.
We're not talking ice baths here, just regular old tap water.
And that's the beauty of it, right? It's simplicity. This easy-to-remember action can significantly lessen the severity of a burn.
20 minutes, that's it. Seriously.
20 minutes, that's all it takes. Research shows that this can actually reduce the need for hospital visits in some cases.
Really?
Yeah, shorten hospital stays and even decrease the likelihood of needing skin grafts later on.
Wow, that's huge. I mean,
bet.
skin grafts are no walk in the park. So what's the science behind this 20-minute miracle?
It's all about stopping that lingering heat deep within the skin layers.
Mm-hmm.
Even after you've removed the source of the burn, that heat continues to damage the tissue. Cool running water helps to dissipate that heat, preventing the burn from worsening.
It's like hitting the brakes on the burning process,
Precisely.
even after the initial damage is done.
And this knowledge is so empowering
Yeah.
because it means that anyone, anywhere, can potentially make a real difference in those crucial moments after a burn.
It's like having a superpower in your back pocket, right?
Right.
You don't need fancy equipment or medical training. Just 20 minutes and some cool running water. So we've covered first aid.
Right.
But Dr. Palmieri's article also talks about these updated guidelines for transferring burn patients to specialized centers.
And this is where things get really interesting. These new guidelines are all about getting the right patient to the right level of care as quickly as possible. It's a shift towards a more personalized approach.
So instead of just looking at the size of the burn,
Right.
they're taking other factors into account.
Precisely. Things like the location of the burn.
Mhm.
Is it on the face, hands, feet, or near a joint?
Mhm.
Those areas often require specialized care, regardless of the size of the burn.
That makes sense. Those areas are so delicate.
Exactly. And it's not just the location, they're also factoring in pre-existing conditions. For example, a diabetic patient with a smaller burn
Okay.
might need to be transferred to a specialized center sooner because their healing process might be more complex.
So it's like personalized medicine for burn care.
Yeah.
That's pretty amazing. But this focus on personalized care got me thinking.
Yeah.
Are there any areas where the standard practices are being totally flipped on their heads?
You're really thinking like a true deep diver here. And the answer is absolutely. Take, for example, the medication hydroxycobalamin.
Okay.
It's used to treat cyanide poisoning,
Right.
which is a huge risk with smoke inhalation.
Right. Smoke inhalation, that's a whole other beast when it comes to burns.
Absolutely. And hydroxycobalamin, it's a lifesaver in these situations.
Yeah.
But, as Dr. Palmieri points out, it comes with some unexpected side effects.
Unexpected how? Like what kind of side effects are we talking about?
Well, for one, it can actually turn a patient's urine
What?
and even their skin a purplish red color.
Whoa, wait, seriously, purplish red? That's going to throw a wrench in things for the medical team trying to assess the burn.
It definitely complicates things. It can be difficult to accurately gauge the burn's depth when you've got that discoloration to contend with.
I bet. And to make matters worse, doesn't it also mess with some medical equipment?
You're right. It can interfere with certain equipment, including something as vital as hemodialysis machines.
So it's a lifesaver, but it can also create complications.
Right.
That's a tough one. Does that mean they're considering not using it anymore?
Not at all.
Yeah.
It's still a crucial treatment for cyanide poisoning, but the key takeaway here is the importance of carefully considering potential complications, even with life-saving interventions.
Weighing the risks and benefits, right.
Right.
And constantly adapting and refining our approach. Which brings us to another cornerstone of burn care that Dr. Palmieri discusses, fluid resuscitation.
Yes, and this is a fascinating area where long-held beliefs are being challenged. For decades, the go-to method for resuscitation has been the Parkland formula,
Okay.
which basically dictates how much fluid a patient should receive based on the size of their burn.
Okay, so the bigger the burn, the more fluids. Makes sense, right. But you're saying that's being questioned now.
Exactly. There's growing concern about something called fluid creep, meaning we might have been giving patients too much fluid based on the Parkland formula.
Wait, too much fluid? How is that even possible? I mean, don't burn victims need extra fluids to compensate for the fluid loss?
They absolutely do. But too much of a good thing, even something as essential as fluids, can be harmful.
Okay, that makes sense. But what kind of harm are we talking about here?
Think about it. Excessive fluid can lead to a whole cascade of complications.
Oh.
It can cause swelling in the abdomen, which can be dangerous.
Yeah.
It can put extra strain on the heart and lungs. And it can even cause vision problems. And we're talking about patients who are already in a critical state.
So with these risks in mind,
Right.
it's back to the drawing board for fluid resuscitation.
In a way, yes.
Right.
The good news is new guidelines are emerging.
Okay.
That suggests a more tailored approach. Instead of regionally following the Parkland formula,
Right.
the idea is to start with lower initial fluid volumes
Okay.
and then carefully monitor the patient's response.
So it's less about a one-size-fits-all formula
Right.
and more about what each individual patient needs.
Precisely. It's about finding that sweet spot. Enough fluid to support their recovery, but not so much that it causes further harm.
Yeah.
And that's where things get really interesting. We're seeing a resurgence of interest in using colloids,
Oh, yeah.
specifically albumin and fresh frozen plasma in bone resuscitation.
Colloids, now those ring a bell.
Yeah.
Remind me, what are they exactly?
Think of them like specialized proteins that help keep fluids within the blood vessels.
Okay.
Remember how we talked about damaged capillaries leaking fluid in burn patients?
Right, like leaky pipes causing all that dangerous swelling.
Exactly. Well, colloids act like tiny sealants, helping to plug those leaks and keep the fluids where they belong inside the blood vessels.
So they're like little helpers,
Yes.
making sure those fluids go where they're supposed to go.
That's a great way to put it. And early research is showing some promising results. Using colloids like albumin and fresh frozen plasma seems to improve fluid balance in burn patients, potentially reducing the overall amount of fluid needed and minimizing those scary side effects we talked about.
It's like fine-tuning the whole resuscitation process. But are there any downsides to using these colloids?
That's the million-dollar question with any medical intervention, isn't it? Weighing the potential benefits against any risks. With colloids, there's a slight chance of allergic reactions, and there's still some debate about their long-term effects.
So more research is needed.
Exactly. The good news is there are ongoing studies, like the Abrupti trial,
Okay.
looking specifically at the effectiveness and safety of using albumin in burn patients.
Okay.
Every day, we're getting closer to understanding the full potential of these treatments.
That's what I love about this field. Always pushing the boundaries and finding new ways to improve patient care. And speaking of pushing boundaries, we have to talk about the really futuristic stuff. Skin substitutes.
Right.
Dr. Palmieri's article mentioned two in particular, Novosorb BTM and RECELL.
Yeah.
Before we dive into those,
Okay.
can you give us a quick rundown on what skin substitutes are and how they work?
Imagine having a protective, temporary covering that you could place over a burn wound to help it heal. That's skin substitutes in a nutshell.
Okay.
They're designed to act like a stand-in for healthy skin, while the body works its magic to regenerate its own tissue.
So it's like giving your body's natural healing process a little boost.
Exactly. Now, Novosorb BTM
Okay.
is a great example of a synthetic skin substitute. It's a two-layer system. The fourth layer acts like a shield, protecting the wound from infection and preventing moisture loss.
Okay.
Meanwhile, the second layer acts as a foundation, encouraging new blood vessels and tissue to grow.
Like building a scaffold to support the growth of new, healthy skin.
A perfect analogy. Now, if Novosorb is like building a scaffold, RECELL is like bringing in a whole team of specialized builders,
Right.
and those builders are the patient's own cells.
Wait, are you telling me they're actually using a patient's own cells to help heal their burns?
Yes.
How is that even possible?
This is where things get really mind-blowing. They take a small sample of the patient's healthy skin,
Okay.
isolate specific cells like fibroblasts and melanocytes,
Okay.
and then get this, they process these cells in a lab to create a solution that can be sprayed directly onto the burn wound.
So they're basically harnessing the power of the patient's own body to heal itself. That's incredible. But why go through all that trouble? What's the advantage of using the patient's own cells?
That's a great question. Since it's their own cells,
Right?
there's a much lower risk of rejection or complications compared to using synthetic materials.
Right.
It's a testament to how far regenerative medicine has come and the incredible potential it holds for the future of burn care.
It's like science fiction becoming reality right before our eyes.
Huh.
Okay, so we've covered some seriously high-tech advancements, but Dr. Palmieri also stressed something that's surprisingly low-tech, but equally important. Early mobilization.
This is one of those aha moments in medicine where you had to rethink what we thought we knew.
Yeah,
It seems counterintuitive, right?
right.
Someone has severe burns, so you'd think we'd want to keep them as still as possible.
Right. You'd think rest is best. Let the body focus on healing. But you're saying that's not the case.
Not anymore. The old way of thinking was to keep patients on bed rest for long periods,
Yeah.
especially to protect fragile skin grafts.
Yeah.
But as we're learning, early controlled movement is actually much better for recovery overall.
Interesting. So how early are we talking about here? Are they getting patients up and running marathons right after surgery?
Not quite marathons, but the idea is to get them moving as soon as the medical team deems it safe.
Okay.
This could be something as simple as range of motion exercises while they're still in bed,
Okay.
or even helping them to stand and walk with assistance as soon as possible.
So even though it seems counterintuitive, getting burn patients moving, even a little bit, can make a big difference in their recovery. I'm picking up on a theme here.
Yeah.
Sometimes the simplest solutions are the most powerful.
It's amazing how resilient the human body is, right? And when it comes to burn recovery, early mobilization has a whole host of benefits.
Like what? Give me the rundown.
Well, for starters, it helps prevent muscle loss, which is a common problem for burn patients who are bedridden for long stretches. It also improves circulation, which is essential for healing, and reduces the risk of complications like blood clots and pressure sores.
Oh.
And let's not forget the psychological boost of getting patients up and moving. It helps them regain their strength, their independence, and their sense of hope.
It's about treating the whole person, not just the injury.
Exactly. It's about understanding that every aspect of recovery is interconnected.
You know, it's a bit like how after surgery, they're always encouraging patients to get up and walk around as soon as possible,
Right.
even if it's just a few steps.
Right.
It seems like the same principle applies here.
Absolutely. It's about shifting our mindset from passive recovery to active healing. And that brings us back to a central theme in Dr. Palmieri's article. The field of burn care is constantly evolving.
It's exciting to see how much progress is being made. It really gives hope to those facing these incredibly challenging injuries.
And that's what makes this field so inspiring, the relentless pursuit of better treatments, better outcomes, and a better quality of life for burn survivors.
It's like Dr. Palmieri said, the need to reevaluate and improve remains a constant.
Precisely. And that's great takeaway for our listeners today. As we uncover these incredible advancements in burn care, it begs the question, what other medical practices that we consider standard today might be revolutionized in the future?
It's definitely something to ponder. And hey, maybe the next time you reach for that bag of frozen peas after a minor burn, you'll remember this deep dive and opt for 20 minutes of cool running water instead.
Right.
You never know. That simple switch could make all the difference.
Absolutely.
Thanks for diving deep with us. Until next time, keep those brains curious. And remember, there's always more to learn.